Hey everyone, welcome back to the channel. I'm Javier, and today we're diving into the groundbreaking world of medical imaging with Hyperfine Inc. and the revolutionary system called the Swoop. The Swoop is a portable MRI system that is changing the game for brain imaging, making it more accessible and efficient than ever before. So if you're a healthcare professional, a patient, or a stockholder, or just someone just fascinated by the latest advancements in medical devices, this video is for you, so let's get into it. Let's begin. What is Hyperfine, you might ask? Hyperfine is the pioneering medical device company that brought us the Swoop portable MRI system. This is the world's first FDA cleared, it's AI powered, it's portable, ultra low field magnetic resonance brain imaging device. So it is designed to provide non-invasive brain imaging at the point of care at various clinical applications. The Swoop system brings brain imaging to the patient's bedside, allowing for timely clinical decisions and efficient use of hospital resources. The Swoop system is designed to be user friendly. So there's a picture of it right here on the screen where it looks like it can be wheeled to the patient's bedside. It can be plugged into a standard electrical wall outlet, and it can be controlled by an iPad. So unlike the traditional MRI systems, which require a dedicated room and a significant infrastructure, the Swoop system can be easily moved between patients and it fits through a standard door. So this means that patients can receive high quality images at low magnetic field strength of the brain in a variety of settings, including the intensive care unit, the emergency department, the pediatric facilities, essentially at the patient's bedside, which makes it a very cost effective and accessible option for healthcare facilities. From my personal experience, because I do work at an ICU, if I have to transport a patient from the ICU down to the radiology lab or the MRI room, I have to make sure that I have all the resources necessary from the staffing to the medical equipment, including their medications, their IV poles, ventilators, oxygen, their monitor, anything else that is attached to the patient has to be coordinated effectively. So that also means pulling resources off the floor, so such as the nurse. Sometimes I have to bring another nurse with me, especially if it's not the most stable patient. I have to bring respiratory therapy with me because they usually are the ones who have or manage the ventilators that are attached to the patients. So the swoop can potentially be brought to the bedside in the ICU, and pretty much you can do the scan there at the bedside. While you still have to move the patient, it is less work to move from a different floor to the lower floors and back and forth. I have had codes in the elevator before, which are not the ideal time to code because, for one, you're stuck in the elevator, or you're not really stuck, but like you have to work within the elevator, and everyone is trying to get the patient back to where they're supposed to be. So you end up doing chest compressions while you're in the elevator. So you end up jumping on the bed eventually and start doing chest compressions in the bed, and somebody else is trying to push the bed back into the room. So it can get really complex. And that is why I think the swoop system, if it can be implemented at a mass scale, will be beneficial to patients. Another application for the swoop system is within the pediatric facility. Pediatric patients are small, therefore, they can potentially attain complete MRI scans without the need of a high field MRI. And the swoop system is a safe design that allows for family members to stay close, which can provide comfort during brain imaging for the pediatric patients. I do want to show a video here that is on their webpage. So if you click under specialties, go to pediatrics, it will show you the little video that they have. So you can read more about the system, but let's watch this video. See how they're pushing it into the bed or into the room. Plugs into a regular outlet, turn it on. And that's the iPad that they use to control it. Slide the patient back out. Remove the pad, wipe it down with some cavi wipes. And it's that simple. And you would get a scan within, what? Well, it was like less than a minute. But I mean, it was sped up for sure, but you could probably get a scan within 5 minutes or less. In terms of performance, the Swoop system has demonstrated high accuracy for the detection of brain hemorrhage in a study published in Nature Communications. It also has shown promise in the early detection of acute brain injury in ECMO patients, according to an observational study. It also has potential applications in Alzheimer's disease and stroke. For Alzheimer's, Hyperfine has announced the presentation of initial data from observational clinical studies evaluating the use of the portable MRI imaging for patients with Alzheimer's. The study essentially aims to assess the potential of the Swoop system in detecting and monitoring Alzheimer's disease progression by detecting amyloid related imaging abnormalities, or ARIA, in patients receiving amyloid targeting therapy. There are a few researchers mentioned here in this study, one being from Washington University, and they're actively enrolling patients in the CARE PMR study, presented on a poster titled Advanced Imaging Modalities for ARIA Detection and Treatment Efficacy Monitoring in Lecanemab Therapy for Alzheimer's Disease, a collaborative prospective study. So the poster, authored by Jude Patrick et al., reported data on 16 patients. Notably, one participant exhibited evidence of hyperintensity on flare, consistent with ARIA-E, which is deemed well detected at low field strength. In another study done by researchers from the Massachusetts General Hospital, they presented virtually a poster titled Portable Low Field MRI for Alzheimer's Disease, authored by Taylor Kimberly et al. So it means other researchers as well. So this poster focused on the quantitative assessment of ultra low field MRI images compared to a conventional high field MRI image in evaluating brain morphometry in Alzheimer's patients. This study highlighted a strong agreement in volumes between conventional high field MRI images and low field MRI images. The poster concluded, given its portability and low operational cost, low field MRI holds promise as a valuable tool to diagnose Alzheimer's disease and monitor its progression. Overall, what it's saying is that the high field MRI and the low field MRI are showing the same results, which essentially means that the low field MRI would be very beneficial in Alzheimer's disease and monitoring of its progression. On July 17, 2024, Hyperfine received its FDA clearance for the software update that enables faster acquisition of best-in-class ultra-low field brain images. This advanced software significantly reduces scan times across multiple MR sequences without sacrificing image quality. These scan time reductions may enable the Swoop system images to help speed up the diagnostic process in acute care settings, which is crucial for time-sensitive medical conditions such as stroke, where every second counts. Reducing the overall acquisition time for sequences can also decrease the negative impact of patient motion on image quality. The total number of Hyperfine AI-powered marketing authorization places the company in a leading position on the FDA's artificial intelligence and machine learning enabled medical devices list, underscoring the commitment of Hyperfine to leveraging AI to advance ultra low field portable MR brain imaging technology and improve patient care. Okay, so that was a mouthful. Basically, the AI will help clear up images, decrease any motion that's detected, and it will lead to a faster diagnosis, especially in acute care settings. Another study that I want to mention is the stroke study that will be published on August 24. I think this study will be a great catalyst for a stock price specifically. There's no guarantee that they will publish great results, but if they do, I think the stock could potentially skyrocket to the moon. It is important to mention that the Swoop system has a lot of limitations still, one being that it does use the ultra low field magnetic resonance, which may not provide the same level of image quality as the high field MRI systems. Additionally, it is currently limited only to the brain imaging and may not be suitable for other types of imaging. Hyperfine's financial performance is highly dependent on its ability to secure regulatory approvals and reimbursements for its products. While it has made progress in this area, there are still a lot of risks that could face delays or setbacks in the approval process. Okay, moving on to their financials. You can find this information in the Hyperfine Investor Relations page where they published their results. I will cover the second quarter 24 financial results. The revenues for the second quarter of 24 were a record of 3.6 million, which is up 7.4 compared to 3.3 million in the second quarter of 23. Hyperfine sold 13 commercial swoop systems in the second quarter of 24. Gross margins for the second quarter of 24 were a record 1.8 million compared to the 1.4 million in the second quarter of 23, which translates to a gross margin percentage of 49.6% compared to 42.7 in the second quarter of 23. Research and development expenses for the second quarter of 24 were 5.9 million compared to 5.3 million in the second quarter of 23. Sales, marketing, general, and administrative expenses for the second quarter of 24 were 6.6 million compared to 7.8 million in the second quarter of 23. Net loss for the second quarter of 24 was 10.1 million, equating to a net loss of 0.14 per share as compared to a net loss of 10.6 million or a net loss of 0.15 per share for the second quarter of 23. For their financial guidance, management raises its revenue expectations for the full year 24 to be 13 to 16 million from 12 to 15 million previously, which is reflecting year over year growth of 31% at the midpoint compared to 22% previously. Management continues to expect its cash burn for the full year 24 to be approximately 40 million, which means they will also be working to secure additional funding to support its research and development efforts and expand its commercial operations, which will lead to potential dilution of the shareholders depending on how they attain this financing. It is important to note that medical device companies do not have great financial health. For Hyperfine, there is no guarantee that it will be widely adopted by healthcare providers or that it will generate significant revenue for the company. Another risk to consider is the competitive landscape. Hyperfine is not the only company developing portable MRI systems. There are other players in the market, such as GE Healthcare and Siemens Healthcare, that could potentially capture market share and hinder Hyperfine's growth. So, in conclusion, Hyperfine is all about potential. They still have a lot to prove to shareholders. I do hold the shares. I am holding 5,200 shares, which is equivalent to 3.93% of my portfolio. It is the fourth biggest holding by equity in my portfolio. I do have this recurring investment as well that I'm buying Hyperfine when the market is open, $1 worth. The market cap for Hyperfine is currently at 78 million, which makes it a penny stock. That means this stock can go to 1 cent tomorrow, or it can literally go to $20 the next day because it's such a small company. I have had success in the past picking medical stocks. I bought into Shockwave Medical way before it received FDA approval, and before that time, it was making crazy swings from $20 to $50 the next day. And finally, it was bought out by Johnson and Johnson at $334. and that medical stock actually helped my portfolio when everything else was dropping. And at that time, I was kind of all in on Shockwave Medical, and it saved my portfolio, and that's how it helped me maintain my equity and my wealth at that time. I have since diversified my portfolio because as you stay in the market for a while, I've been investing since 2016 before I graduated college. Since then, I used to make crazy swings with penny stocks, and now I'm investing and diversifying more. So I don't have these crazy swings as much. So make sure you're doing your due diligence, consult with a professional before investing into penny stocks. I hope you liked the video. Make sure you leave a comment in the section below because it does help this channel grow. Do not forget to subscribe if you want to continue watching videos similar to this one. Thank you and see you on the next video.